Hi, everybody. The article I read was entitled, Can the Neck Contribute to Persistent Symptoms Post-Concussion? A Prospective Descriptive Case Series. This is the November article of JOSPT. The article was interesting, nothing really that new that I learned from reading it, but it kind of confirmed everything we do in our practice daily, and that'll be shown in some of the findings that I uncovered as I read. It was interesting, but pretty consistent with how we treat in terms of exploring neck pain for post-concussive symptoms and its correlation with limitations in returning to regular activity. So cervical spine and connection with concussion symptoms. Clinicians must consider the neck as an alternative source of symptoms when evaluating people following a potential concussion. Many of the hallmark signs of concussion are very, very similar to cervical spine injuries: headaches, dizziness, and neck pain. So it is likely that if someone sustains a concussion, they will also sustain some of these symptoms. So they're oftentimes always there when someone has a concussion, but if you're developing some post-concussive symptoms, it's really important to also look at the neck with a little bit more precision and specificity. In sports-related concussions, neck and vestibular PT can decrease time to medical clearance and return to sport. So with the more accurate matchup of PT rehab with a concussion, sometimes you can return to your sport earlier than you would if you didn't have the appropriate treatment. It is reasonable to consider that neck-related symptoms may reduce the impact of persistent symptoms in the development of post-concussive syndrome. So post-concussive syndrome is a syndrome that is long after a concussion has occurred, and they're lingering chronic type symptoms. And in this article, it said that they may be more contributory from the neck than other things. So that was interesting to me. The purpose of this study was to assess people with a persistent symptoms following concussion who were referred for neck assessment. So keep in mind they were referred for neck assessment. They were assessed via a multidisciplinary concussion service. This was in New Zealand, and it was a group of military personnel. They assessed people with persistent symptoms following concussion to determine whether the neck had also been injured, and they were already identified as having a neck injury, not specifically location, but they were assessed for a neck injury, and evaluate the potential for the neck to contribute to long-term symptoms. So some of the findings: concussion and neck pain can be concurrent, obviously. There had previously been a lack of studies that looked into the role of neck pain in concussed patients that experienced symptoms for a longer period of time. So it appeared through the article that there have been research that focused on neck pain and more acute type symptoms. This is neck pain and more post-concussive syndrome in terms of the chronic or chronicity of symptoms from a concussion. In this study, PTs considered the neck to contribute to current symptoms in 90% of cases referred for assessment. So in a huge majority of cases, neck pain was contributory to some of the long-term symptoms they were having. So based on this article, it only makes sense to also look at the neck, especially if the person comes in more chronic stages and if they've been identified as having post-concussive syndrome. These findings highlight the importance for a multidisciplinary approach to treatment of post-concussive patients, obviously. So it only makes sense that there should be multiple health professional involved: PT, MD, neurologist if appropriate, vestibular PT, if the symptoms that the patient are experiencing wouldn't be matched with needing all those people to care for them. A PT should be assessing this patient and helping to manage their neck pain. So some of the other findings, a little more specific to the neck: PTs that work with patients with neck pain that might have sustained a concussion should start with the cervical spine. So that's where they found that the majority of the symptoms in terms of the cervical spine emanate from for post-concussive patients. Some of the other findings that they found specifically for the neck with concussive patients were moderate to severe neck stiffness, was kind of across the board during segmental assessment of upper cervical spine, suboccipital tenderness, and asymmetrical flexion and rotation. So again, these are very similar findings that you see someone with neck pain, also someone that had concussive symptoms. These symptoms are also present with cervical spine dysfunction and post-concussive symptoms. So some of the clinical implications: you should always assess neck pain and do not only treat vestibular and cognitive effects of concussion, both in subacute and chronic stages. So basically the article said that you need to be really mindful of in a chronic patient that has a concussion to you can't ignore the neck long term. So if you do treat it acutely, if you're clear to do that, but it has to be something that you treat long term and make sure that you check stiffness, the segmental assessment, and the range of motion, because those can contribute to having symptoms for longer. One of the clinical pearls that I found was that neck-related findings are important to recognize as they have the potential to actually contribute to post-concussive syndrome, which I thought was interesting. They didn't really go into that much, maybe because of the chronicity of the syndrome, but I thought that was interesting. So this article was really about long-term symptoms of concussion and its high correlation with neck pain.